Good day. Let's talk about PE or pulmonary embolism. This is a lung clot that happens in the main blood vessels that come out of the right lower chamber or the right ventricle and supply blood to the lungs. In this image to the right, you can see a CAT scan with the dark area which represents the clot and does not fill with the white contrast. If the PE is large, it can cause significant back pressure on your right lower chamber or the right ventricle and hurt your heart. This is an urgent situation where we sometimes pass a straw or catheter from the blood vessels into the right ventricle into the blood vessel that has the clot and give medications to bust the clot. In other cases, if it's not very dangerous, we give IV medications to dissolve the clot over time. So if we are concerned about a pulmonary embolus, we will generally look to see if there is stress on the heart. And we do that by either using an echocardiogram, where you can see the right ventricle looks like the largest chamber in the heart because it's experiencing a lot of back pressure. The image on the right is a CAT scan where you see the right ventricle is again the largest chamber in the heart because of back pressure from the pulmonary embolus. The most common cause of a PE is if a DVT or a deep vein thrombosis or a blood clot in the legs or the arms travels into the heart, out into the lungs and causes a clot. If you keep having problems with many episodes of DVT or PE, your heart doctor might send you to a blood doctor to see if you have a tendency for clotting problems. Thank you. This is Dr. Mehta.